Doctor Felipe, my transplant didn't work out. My hair isn't growing. I'm 2 months post-op.
Let's go to the post-operative 2 weeks to 1 year.
So what is going to happen that is so important in this period?
Let's start with the first few months there. From the 14th, 15th day, the cones start to fall off, okay?
When the cones fall, you don't need to be desperate, because wires may fall along with the cones, okay? When the cones finish falling, it will look nice, because it looks like everything is shaved off, okay?
So, at that moment, you have to take advantage of it, because soon these strands will start to fall out.
And remember that you have to go back to using minoxidil in capsules and minoxidil for topical use. Don't forget, you go back to clinical treatment.
Well, in addition, note that from the 3rd week onwards, the implanted hairs begin to fall out. The native threads, that is, the original ones that you already had before, they grow slowly, but the implanted threads become loose, they fall out.
So, 2 months after the operation, we will practically have no wires implanted in the implanted region. Oh, drive. Felipe, but does this happen to all patients?
No, there are some patients who still have that wire implanted for more than 2-3 months, okay? But don't create that expectation, it won't happen to you. Remember that everything will be naked, it will be smooth, the skin on the scalp becomes smooth and worse, besides being smooth, it becomes reddish in the implanted region, okay?
So remember that, okay?
In the 3rd month, 3 months after the surgery, some hairs begin to grow, but it is not a homogeneous growth. A cat is born from here, another from there, it gives you anxiety, a feeling that the surgery did not work. Your friend will arrive, he will make fun of you, he will talk, he threw money away, he will laugh in your face.
Be patient, okay?
Be patient because in the 4th month there is hairiness, a thinner thread, homogeneous growth begins, you start to get carried away, your friend already regrets it, he comes to ask for the phone number of the doctor who operated on you and so on.
So, summarizing these first 4 months, the 2nd month and the 3rd month are terrible, they are bad months, which bring anxiety, which bring frustration. This happens to practically 100% of the patients.
Okay.
Oh, drive. Felipe, you're warning me, so it won't happen to me.
It's one thing for you to see this video, it's another thing for you to go through this post-op.
So, remember that you're going to be a little anxious, a little frustrated in those first 3 months.
5th month, the hair starts to thicken. Your objective now is to educate him with a hairstyle according to the angle that was pre-agreed, which we agreed on pre-operatively. You comb your hair, it becomes softer, more natural over the months.
6th month it thickens more, it's still a little rebellious, but you comb it. 7th, 8th month you already start to risk some hairstyles, military cut, a little two-peat and so on, okay?
8th, 9th month, better and better, okay? This wavy, this hair rebellion, it will correct itself around the 10th month, 11th, 12th month, which is when it becomes as natural as possible, okay? Remember that the implanted thread comes from the donor region. The donor region usually has a slightly thicker thread, okay? So, the thread that will grow here will be very similar to the thread in the donor area, okay? And our final result is there, after 12 months.
Remember that, don't create anxiety ahead of time. Some patients have faster growth, so after 4 or 5 months, they have very interesting results.
Not other patients, they will only see really interesting results around the 6th, 7th month.
So you have to be patient. Patients who have a crown operation, the vertex region of the head, growth is even slower, okay?
So it takes us longer to see results, okay?
You have to be patient. The word patience is the word that should accompany the late postoperative period of the hair transplant, okay?
Frequently asked questions for the late postoperative hair transplant. Let's go.
Doctor Felipe, when will I be able to shave my head? Can I shave my head now? Look, you can shave your head after the scabs fall off, okay?
So, when the cone has fallen, you can pass a machine on the donor area, which grows much faster than the native region, the region implanted from above, and starts to clash.
So from there you can go through a machine keeping the hair very short here.
I advise doing this for the next 3-4 months.
Why? Because then you manage to maintain a level of hair without highlighting the donor region, without getting that bozo clown look.
So wait, scrape it off. When it starts to grow up here, you let it grow on the side too.
It's a suggestion, obviously, it can be done any way you want. Another question, Dr. Felipe, my transplant didn't work. The hair isn't growing. I'm 2 months post-op, but of course it's not going to grow. 2 months is the worst phase of hair transplantation. Remember this, 2 months and 3 months. It is the second and third month. The hair is still not growing. The capillary bumbo is still under the skin, that is, the seed is under the skin and still hasn't budded. The seed hasn't borne fruit, it hasn't grown yet, just be patient, okay? After the scabs fall off and the hairs fall out, forget that you had a transplant. You'll remember that only after the 4th month, when we'll actually see the hair growing, okay?
Another question, Dr. Felipe, I have an unbearable itch in the donor area. What should I do? Can you have itching in the donor area and in the implanted area in both regions?
Yes, it's normal, okay? Obviously it varies from each patient.
If you are having a very significant itch, let me know. Let the girls know that we are going to prescribe some substances for you to use to relieve that itch. This itch is normal.
It is nothing more than a cicatricial process, that is, a recovery of the tissue that was moved there, which was implanted.
Okay. Dr. Felipe, I have pimples. It's giving me pimples in the donor area.
Folliculitis, pimples in the donor region and in the implanted region are common in the late postoperative period, okay?
It is not a reason for despair. Just do a discreet massage during the bath with hot water falling on that region. The pimple tends to be absorbed or it tends to poke and leave. In the implanted region, try not to squeeze it with your fingertips, with your nails, so as not to bring infection to that region, okay? They are benign folliculitis. They are pimples that do not cause any harm to the transplant, okay?
Now, if you have diffuse folliculitis with a lot of pimples on your scalp, let our team know so we can do a targeted treatment for this folliculitis, okay?
Another question, Dr. Felipe, can I platinum my implanted hair? Platinum and play chemistry and bleach your hair? Look, if you want to set your hair on fire, it's your hair. You can do whatever you want with your hair. But I don't recommend it. I don't recommend doing Botox sealing, filler, because that causes chronic damage to the hair shaft and it can lead to an acceleration of damage to the native hairline and also chronic damage there that will harm our implanted hairline, okay?
Remember that, I don't advise hair chemistry, okay? Nor is it to the extreme that it cannot be forbidden to do so. In the end, the decision is yours. If you think it will compensate more for the risk of doing hair chemistry,
feel free. Dr. Felipe, can I take anabolic steroids because I already have the transplant?
Guys, come on.
Anabolic steroids are some gym supplements, Tribulus terrestris, Peruvian brand, turksterone, creatine itself, testosterone in injectable gel, orally. They will harm more than the transplanted hair. The transplanted hair will practically not be harmed, but the native thread, that is, the thread that is present next to the implanted thread, okay?
Which is the thread that makes up the final result there.
So, this thread will be harmed. It will continue an accelerated thinning process, okay? Which is all we aim to prevent with clinical treatment. So, I don't recommend it, okay? Let's get away from it, okay?
Unless you have a very precise medical conduct, based on a clinical indication that is not merely aesthetic for lean mass gain, okay? Another question, Dr. Felipe, I want to have the transplant, but I don't want to continue the clinical treatment.
Will I need to undergo clinical treatment even with a transplant?
Obviously yes, okay? If nobody gave you this bad news, I'm saying it now, clinical treatment you're going to have to do for the rest of your life, okay? Because it is not directed to the implanted thread.
Clinical treatment, it is directed to the native thread, that is, to the threads that are still here for the originals here in the corcabeludo region. So, if you don't do the clinical treatment, it's like you're abandoning care for the native threads that are here. For example, we did a transplant, we closed the entrances, but you didn't have the clinical treatment. It may be that in the future your crown will open, understand? So clinical treatment is fundamental.
Então, if you have any other questions regarding the late postoperative period, leave them here in the comments and I will answer them personally, and it will be important for the other patients who will use this video to help in the postoperative period, so that they know also, share the same doubts as you, okay? And if you want to know about the postoperative period from 0 to 15 days, watch this other video here as well. A hug.